And a virologist with the Kumasi Center for Collaborative Research, the KCCR, has cautioned government to tread cautiously in adopting reviewed discharge protocols for COVID-19 carriers as recommended by the World Health Organization. Now, according to Dr. Augustine Angelina Silverkane, a wholesale approach to this directive may be detrimental to the strides made by Ghana in a bid to cap the spread of coronavirus.
So sputum samples may tend to still shed some active or some infectious RNA. And even in the same WHO, the WHO document, they actually cited one study. They named, amazingly, they named it one possible outlier. So there may be some outliers whereby for this particular person in one patient, the viral cultures were positive from upper respiratory tract specimens. It continued to be positive until day 18, even though this person did not show the signs and symptoms of the infection. So I am thinking that as a country, we may want to generate our own local context-based data to enable us or to inform us on some of these discharge protocols. I mean, and some of the studies they actually quoted, they have very, very limited or few number of patients, 9 patients. I mean, I'm just wondering how you can extrapolate results from nine patients. I mean, in another study, they actually included 129 patients, and they themselves concluded that in that particular study, they concluded that 30 of the patients were immunocompromised. But look, we are talking about asymptomatic patients against symptomatic patients. So I am just thinking that, I mean, now the release is already out. Yeah. I don't know if we can go back and tread cautiously. I may appear healthy. I may not even know that I am harboring the virus, but tested, I will turn out to be positive. Yeah. And look, as our number of confirmed cases begin to go up, chances that in the midst of your friends, maybe once a group of people sits together, about 10 people, chances that some of them may be positive, though they may be asymptomatic, may gradually be increasing. In fact, chances that you yourself, you may be positive, is gradually increasing and gradually becoming a reality. I think we should kindly tread cautiously with this straight adoption of this so-called discharge protocol by the WHO.
Well, indeed, this protocol has come under a lot of scrutiny, and we're doing that right here on Joynews Prime. And joining us is Dr. Gabriel Benako. He is the president of the Coalition of NGOs in Health. Now, what is your own take on the revised COVID-19 discharge policy as being adopted by Ghana?
Yeah, Raymond, thank you, Roland, for engaging us. We, the Ghana Coalition of NGO, would like to state that everybody in Ghana should be much more responsible than before in protecting yourself and protecting others within the environment we find ourselves. That's the first thing. The second point is that we all know since January till now, the science and the data have sometimes proved us wrong about the approaches, about the responses, about the containment measures we put in place globally, and much more specifically in Ghana. We all know that WHO statement is stating that likely, and Roland, you and I know that likely is not 100% assurance. So we should tighten our belt. We should not be over complacent, and Ghana actually should not rush to conclude. We rather need to bring more hands on deck. We rather need to support the Ghana Medical Association, the Ghana Midwife and Nurses Council, the civil society, the various Ghana Education Service leaders, and including the media, to continue to support the government strategic plan in fighting this pandemic. We keep on saying that we tend to rush to conclude. That is not good for Ghana. Other countries have rushed and they have failed. Let's continue to do our bit, and we should not rush to conclude on certain research information. From all the indication and from all the practices in Ghana, we have slipped severally. But today we are saying that let's be patient and make sure that Ghana is for us. We are not running away from Ghana. We are not, nobody is forcing us to take certain decisions for the country. Let's run it in a very slow pace and make sure that our institutions are much more institutionalized. The human resources are much more supported to do the needful, and they can be assured of maximum protection. And civil society must play a critical role, including the media. So we want to say that at this point in time, we need to be consolidating the gains we have made, rather than to begin to be complacent about what we are doing.
Now we do know that we have a certain demographics by the population and indicators that we have. And if you just oppose that with what the WHO and some of the best practices in the world, there's every indication that if you have a very young, vibrant population, they tend to be better immune and less malnourished than the related sections as we find elsewhere in the world. That also gives us some great benefit to be able to adopt this strategy, doesn't it?
Raymond, I want to put it to you and to Ghanaians. Coronavirus had dribbled everybody in the world. It has dribbled WHO, it has dribbled the giant, robust health systems in the world, and it has dribbled Africa severally. So we need to take the cue from WHO, but we must have our own grown strategies to match with that advisory services from the WHO.
What do you propose?
And I keep on saying that.
What do you propose?
Says likely.
What do you propose?
Look at the report, likely Raymond is not 100%. And so what we need to do, let's have a contextualized situation. After WHO have declared and have given information, have we brought our scientific industry to sit together? What have Ghana done scientifically? And if you remember, Coalition NGO has been talking about Ghana need to have funding for our scientific industry. Yeah. How much are we even giving to our scientists? Why are we basing on WHO? Why are we not having our own grown research data to either support or otherwise of what other countries or other bodies are advising us? So we slip. And that's why we keep on saying that, please, let's be careful, let's be patient. We all know what government officials have talked about, which have not worked. But we keep on saying that we are all Ghanaians. Civil society are part of Ghana. We will never move from anywhere. We are not causing fear and panic. We are contributing our quota, including the media, to let them know that the science sometimes need to be domesticated. So how much are we giving to our scientific industry?
Yeah. Well, your point well made there. And Dr. Gabriel Benako is the president of the Coalition of NGOs in Health, helping us do that discussion as well. And it follows Dr. Silverkin of the KCCR cautioning government to hasten slowly in the adoption of the new discharge policy as being adopted from the WHO. But